Bismillahirrahmanirrahim. Good morning, everyone. I am Massab Umair. I'm working as a Principal Scientific Officer at National Institute of Health. So today I'll share Pakistan's journey of developing its National Genomic Strategy for priority pathogens, highlighting some of our challenges, our progress, and our vision for 2025-2030. So the first National Genomic Strategy of Pakistan was developed early 2023 through a structured and a collaborative process. So we first developed a technical working group at National Institute of Health. And this technical group used the WHO's Genomic Surveillance Strategy for pathogens with pandemic and epidemic potential as a guidance to align with global best practices. And based on that, this technical working group performed a SWOT analysis of the strengths, weaknesses, opportunities, and threats to analyze the genomic capacities in human health sector in Pakistan. And with the findings of the SWOT analysis, the first genomic strategy of Pakistan was drafted. This strategy was then shared with the National Laboratory Working Group for their review and technical inputs. And after that, this strategy was also shared with IQLS for validation. And lastly, this strategy was endorsed by the National Institute of Health, and this strategy became available in February 2023. So while the 2023 Genomic Strategy of Pakistan was a milestone for us, but it was still a very foundational effort, and we realized there were several gaps while implementing this strategy. Number one, for the SWOT analysis, we did not carry out on-site assessments of the genomic capacities in our human health. So much of the work was done, much of the data was gathered remotely. So there was, no real-time information or information about the existing capacities at that time. Secondly, there was no structured method used to prioritize pathogens. Although we included most key human pathogens in that strategy, but there was no systematic framework used to rank the pathogens based on their public health importance, based on their epidemic potential or cross-sectoral relevance. Thirdly, there was no implementation plan developed for the strategy. So although the strategic objectives or the strategic directions, they were very clear, but there were no implementation plan. There were no timelines defined. There were no stakeholders was defined, and there was no method of how to monitor the progress of this implementation. And lastly, this strategy was focused mainly on human health. So there was no integration of One Health. So animal and environment sector, they were not part of this strategy. So keeping in this mind, we decided to develop this strategy, which is more inclusive and which is more evidence-based. In 2025, we started this revision or update of the 2023 strategy, and we used a three-phase approach. In the phase one, we developed structured survey tools to assess the genomic capacities, infrastructure, workforce across the three sectors: human, animal, as well as environment. And using this survey tool, we carried out on-site assessments of the genomic or the sequencing facilities in these three sectors across Pakistan. And the findings from these were used to perform the SWOT analysis. And the result of the SWOT analysis was then added as new strategic objectives in this revised strategy. The phase two was mainly about consultation and about strategy refinement. So in the phase two, we conducted or convened a multi-sectoral workshop. So we had participants from human health, from animal health, from environmental health, and as well as from academia and international partners. So they were all part of this multi-sectoral workshop. So this group basically, it reviewed the 2023 strategy and the phase one work that we did. And based on that, they prioritized samples, they prioritized pathogens for genomic surveillance. And for this, we used a structured way. We used the Asia PGI tool for pathogen prioritization, and under the One Health framework. And also this group, they developed a detailed implementation plan. So they defined, different strategic action, sub-activities, timelines, who is responsible to do what. And lastly, this strategy was again shared with our National Laboratory Working Group for their review and inputs. And finally, this strategy was shared with our Ministry of National Health Services Regulation Coordination for endorsement and approval. So I'll just quickly go through some of the strategic objectives. So, so the revised strategy under the objective 1, it basically centers or it focuses around equity of access. So ensuring that genomic capabilities, they are available across the regions of Pakistan and across the 3 sectors. And to achieve this, we are going to develop a National Genomic Consortium. So it will have representation from the 3 sectors, and we are also, at the subnational level, we are going to develop our provincial technical working groups. And these provincial technical working groups, they will be basically coordinating genomic activities at the provincial level, and so it will also strengthen local ownership. We are going to do a national level mapping of the genomic capacity in Pakistan, and based on the findings from that activity, the National Genomic Consortium and these provincial technical working groups, they are going to advocate for financing and for integration of genomic surveillance in ministries and provincial health departments. So under the objective 2, we basically, it's about, it focuses on, first of all, building and then sustaining skilled genomic workforce in the country. And we all know this is extremely important when we talk about surveillance systems. So to achieve this, we are going to train and retrain our bioinformaticians, our scientists, molecular biologists, and data managers. And to get to that point, what we plan to, make exchange. We're going to have an exchange program where people working in the 3 sectors, they are going to share their expertise or their knowledge or best practices with each other. Apart from that, we are also planning to develop a One Health Genomic Fellowship, so which will have a structured training, which will have mentorship, and which will also have competency-based learning. So under objective 3, it basically emphasizes about strengthening data sharing and utility. So the purpose here is to make sure that the genomic data is translated into action for public health. So to achieve this third objective, we are going to establish, first of all, a national genomic data repository for Pakistan, so that will store and manage pathogen genomic data from the 3 sectors, and this will be led by National Institute of Health. In addition to that, we are preparing a real-time genomic dashboard that will be integrated with this data bank, this national repository. So health authorities, they will have they can visualize the outbreaks or how the pathogens are evolving. Under the 4th objective, it basically again emphasizes connectivity when we talk about the overall surveillance architecture of Pakistan. So it ensures that the genomic data, it flows seamlessly across the systems, across the 3 sectors. And for this, our main priority is to integrate our genomic data into DHIS2. So the health authorities, they have real-time access to not only the epidemiological data, but to the genomic data. And the last, in the 5th objective, is basically about preparedness. So making sure that we are prepared before an outbreak. And for this, our National Genomic Consortium, it will be playing a very key role, and we also, plan to establish rapid response laboratories that will be equipped to maintain, sequencing search capacities for high-risk pathogens. So these are some of the, objectives that we have, drafted in our national strategy. Okay, so now our focus is on implementation and sustainability as we move forward. And to achieve that, the immediate steps are, we plan to integrate genomic surveillance in routine health budgets. We plan to execute the phased implementation plan. And thirdly, we plan to establish the data platforms for integration of genomic data at the national level, so that the laboratories across the country are linked to each other. So there were a number of learnings when we developed this strategy for Pakistan, but I think these learnings can be used by global community who are designing their own genomic frameworks, and I'll share some of the key learnings here. So first of all, we realized that multi-sectoral engagement was key, involving the human health, animal health, environment sector at the outset was very important. Secondly, we realized that data-driven planning, which is based on on-site assessments of genomic capacities, it is very important, provides a foundation for national goal setting. Thirdly, early engagement of ministries, our policymakers, our decision makers, we realize it's really important for two reasons. First, it has a governmental ownership, and secondly, it ensures that your strategy, it aligns with the national priorities. And lastly, we realized that maintaining flexibility and mechanisms for regular review is important, so that the strategy is responsive to emerging or evolving science and technologies. So with this, I would like to thank our Ministry of National Health Services Regulation Coordination, NIH, AIDS Healthcare Foundation for providing financial support for revision of this strategy, Asia PGI for giving us access to that prioritization tool. And before I finish, I'm really excited to share that just yesterday, my book got published. So it is pretty much what we have been discussing here. Thank you. So it's about my journey throughout the pandemic. So we have been discussing how we can use genomic data to inform policymakers, to inform public health decision making. So I have discussed all that, how we use genomic data, to achieve these targets in Pakistan during COVID pandemic, then during Mpox emergency, then for dengue and for so many other viruses. And I've also discussed the importance of laboratory leadership, the importance of collaborations, multi-sectoral engagement, and a lot of my personal experience of briefing at the National Command and Operations Center, and how effective communication, it's important to advocate at the highest level. So all this is in this book. So if you are interested, this is available on Amazon, so you can read it. So thank you so much.